We do courtesy LASIK evaluations here at Woodhams Eye Clinic, and it is a pretty lengthy process. You'll be here for about 2 hours where we use our state-of-the-art diagnostic testing equipment and imaging software to make sure that you are a good candidate. So the imaging software primarily is measuring the thickness of the cornea, making sure that each patient has a thick, healthy cornea, checking the mapping of the cornea. We do have instruments that check the curvature, the mapping, make sure there's no irregularities. And then of course we have instruments that check the overall health of the eye, the retina, and we want to make sure everything is healthy front to back. So during the consultation, you'll meet with either one of the optometrists or the surgeon, and they will review all of your imaging here in the office with you. And depending on your prescription and the measurements, as long as you're a good candidate, we're ready to move forward, and we have you meet with a surgical counselor the same day to talk about scheduling, financing, and cost. So LASIK can correct for nearsightedness, farsightedness, and different degrees of astigmatism.
LASIK will correct astigmatism. Most of the common types of astigmatism, probably 90%, are very easily correctable with LASIK.
So a lot of our patients that are 50 and older, they come in, they have excellent distance vision, but they are now having to wear reading glasses full time. It's a frustration for them to constantly be putting on readers. For those individuals, there are a couple ways that we can surgically treat. In the case of LASIK, we can do something called monovision or blended monovision, where we can correct one eye for distance, the other eye for near.
We have 4 different lasers that we use depending on the patient's particular situation. We have a Vizx laser, we have the new Quest Nidec laser, IFS for making flaps. It's the all laser type of LASIK. So from a technological point of view, we've always been the technology leader in this part of the country.
Here at Woodhams Eye Clinic, we offer bladeless LASIK, so we do use a laser to create the flap on the front surface. Some practices still use a blade to create that flap, and with the laser, there's less likelihood of a mislodged or dislodged flap or any buttonhole or tear or any issues with the flap. It creates a more smoother flap and allows for the surgeon to treat the cornea very, very easily. So on the day of surgery, expect to be here for about a 2-hour time frame, but the procedure itself takes 10 minutes from start to finish. It is very quick, very rapid.
Most people come with a friend, which is good to drive them home. LASIK is not a painful thing, but it's a nerve-wracking thing because who wouldn't be a little bit nervous, having somebody work on your eyes? But we do give you Valium to help relax you. Progressively stronger numbing and antibiotic drops, so that when you're lying down on the contour couch and looking at the flashing red light, what you feel is just more of a pressure, wetness, that sort of a sensation. There's nothing that's cutting or burning or poking. The entire process from walking into the LASIK room to walking out is usually 10 minutes or less.